Vitamin D cuts second heart attack risk by 50%. New study shows nearly every 40 seconds, someone in the United States suffers a heart attack, a staggering 800,000 cases annually. Of those, approximately 200,000 individuals experience a second heart attack. This underscores the critical need to understand how to mitigate recurrent cardiovascular events. Recent research suggests a surprisingly simple solution: personalized vitamin D supplementation. The study, Targeted Supplementation Makes the Difference researchers followed 630 heart attack survivors, average age 62, and divided them into two groups. Standard care versus a customized vitamin D3 regimen designed to raise blood levels above 40 ng/ml. This is significant because while 30 ng/ml is generally considered sufficient, optimal levels may be higher. Some experts suggest 50 ng/ml. And roughly 43% of US adults already have insufficient vitamin D. The key difference wasn't just giving vitamin D, but adjusting the dose based on regular blood tests. Most participants required around 5,000 IU daily to reach the target range. The goal was to determine if improved vitamin D status impacted the risk of another heart attack, stroke, heart failure, or hospitalization. Striking results: 50% reduction in recurrent heart attacks over the study period. There was no overall difference in major cardiovascular events between the groups. However, when looking specifically at second heart attacks, the results were striking. Participants receiving personalized vitamin D3 supplementation had a nearly 50% lower risk of another cardiac event. Previous studies just gave patients supplementation without regularly checking blood levels of vitamin D to determine what supplementation achieved, explained lead investigator Heidi May, Ph.D. With more targeted treatment, when we checked exactly how supplementation was working and made adjustments, we found that patients had their risk of another heart attack cut in half. These findings were presented at the 2025 American Heart Association scientific sessions, but have not yet been peer-reviewed. Why vitamin D matters for heart health. Vitamin D is well known for its role in bone and immune health, but its cardiovascular benefits are increasingly recognized. The vitamin helps regulate inflammation, supports healthy blood vessel function, and may influence blood pressure and glucose metabolism, all key factors in heart health. How to supplement effectively. Raising vitamin D levels isn't always easy. Many people struggle to get enough from diet or sunlight alone. Supplementation can help, but it's crucial to choose the right form and dose. Choose D3 over D2. D3 is more effective at raising blood levels. Consider absorption. Some supplements are formulated to enhance absorption. Regular testing. Get your vitamin D levels checked annually or more frequently if needed to personalize your dose. The takeaway: this study provides compelling evidence that a targeted approach to vitamin D supplementation can significantly reduce the risk of a second heart attack. It highlights the importance of personalized care, particularly for nutrients where individual needs vary. If you're at high risk for heart disease or simply want to optimize your cardiovascular health, regular vitamin D testing and appropriate supplementation may be a crucial step. This research underscores that sometimes the simplest interventions can have the most profound impact.